Monday before Thanksgiving, as you are taking time away, hopefully not from family or from cooking potatoes or something. We are so excited to have everybody here tonight. Welcome to the American Palliative Rehabilitation Alliance, which is an interprofessional group which, in our opinion, is the way to solve many of the problems in our current healthcare system, is by working together as a team. So we are here tonight to talk about acupuncture, and I'm going to turn the mic over to Lori so she can introduce our guest speaker. And thank you so much, Dr. Z, for being here.
Absolutely, Anne. Thank you. And I do just want to mention we are also joined by others on our American Palliative Rehab Alliance leadership, Chris Wilson and Kristen Cumming. I was introduced by our featured speaker this evening by a mutual colleague, and I'm honored to introduce him to you guys as well. Ziad Elias is a board-certified and licensed acupuncturist with Henry Ford Health. He received his master's degree from the Pacific College of Health Science in Chicago and his postgraduate doctorate in acupuncture and oriental medicine from Bastyr University in Seattle, where he specialized in integrative oncology and pain management. His studies involved in vitro research on the effects of Chinese herbs on cancer, with a focus on triple-negative breast adenocarcinoma, as well as externships in China, where he received additional oncology certifications from the Sichuan Cancer Hospital. I hope I am saying that properly. Where he of integrated and Chinese Western medicine and the Shanghai University of Traditional Chinese Medicine. He also holds an international certificate in oncology acupuncture from the TCM Academy of Integrative Medicine and is nationally board certified in Chinese herbal medicine. Ziad has served as vice president of the Washington East Asian Medicine Association and later as vice chair for the American Society of Acupuncturists. Before returning to Michigan, he worked at cancer treatment centers in Washington State, integrating acupuncture and Chinese herbal medicine alongside conventional care. He continues to do so at the Henry Ford Cancer Institute in Detroit and regularly provides lectures to physicians, nurses, allied health professionals, and patients about acupuncture and its benefits. He also holds an associate professorship for research at Michigan State's College of Human Medicine. Welcome so much, Dr. Z, as he is affectionately called in our circles. And we are delighted to have you and are excited to learn from you and your expertise.
Thank you, Laura. It's nice to see you again and nice to meet all of you guys as well. All right, so let me share my screen. Let's confirm that it's working okay. Let's see. Oh, let's see.
While he's getting that set up, just from the perspective of housekeeping, feel free to ask questions in the chat. Chris and I will be monitoring that, and we also will have time at the end for questions.
Is that showing up yet on your guys' screen? No. Okay, here we go.
Got it. We see it.
Okay. How is that?
Perfect.
Okay, good. All right, so as Lori already introduced, my name is Ziad Elias. Please call me Z for short. We don't have to have the formalities. We're all colleagues here. So this lecture is going to be covering a wide swath of things in the acupuncture setting in palliative medicine. It's a pretty ambitious lecture. I have quite a lot in here to show you guys. We're going to start kind of broad with kind of some simple definitions with respect to terminology used in the field, drill down a little bit on some research, and then kind of zoom back out a little bit on some more practical things and considerations. So first things first, no conflicts to disclose. And the agenda here, we're going to go over a little bit about CAM and integrative medicine, some of the terminology, some of the utilization, some background and history about acupuncture and Chinese medicine, conditions and research amenable to acupuncture, and some of the research behind that. some mechanisms about acupuncture and some misunderstandings as well. There's quite a bit of misinformation online about acupuncture, so I'm going to help clarify some of that. Some logistics about acupuncture and some resources you guys can go home with as well. So you guys may hear various terms that refer to these kind of therapies that are kind of on the fringe, let's just say, so you may hear of things like complementary or alternative or integrative, and it's kind of mixed in with the conventional jargon of biomedicine and so on and so forth, orthodox Western medicine. So just to kind of clarify all that, there are some distinctions between these terms. So conventional medicines, which you're all accustomed to and know about, that's allopathic medicine. That's what MDs and DOs use to treat and manage symptoms using standard methods, medication, surgery, rehab, of course. Sorry about that. Complementary uses non-mainstream therapies alongside conventional. So it complements Western medicine, for instance. So these include things like herbs and supplements, massage, meditation, chiropractic, acupuncture, for instance, too. Alternative is as it sounds, instead of conventional. This is not advised, of course, but and also in some parts of the world, this may be what we think as alternative may be the norm, right? So it is kind of relative. But broadly speaking, as it applies to us, alternative is instead of Western medicine. Integrative medicine is complementary medicine with an evidence-based, so those are many of the things that we'll kind of discuss today, elements of chiropractic, massage, and so on, that has a evidence-based to support its use and its safety. So quick and dirty, conventional medicine is a standard, complementary is together with conventional medicine, alternatives instead of, integrative is together with evidence. So there had been enough interest with respect to these kind of complementary therapies that eventually the NIH had developed a department for complementary and integrative medicine that was established in 1999. So, and that's fortunately continues today. I don't know how long that's going to last, but we'll see. Now, utilization of complementary and alternative medicine. So the NIH and CDC had looked at the utilization among adults of these different therapies. So you can kind of see on the screen here the various therapies that were assessed. Of course, ranging from acupuncture all the way down to yoga, tai chi, and qigong. What we find was a pretty consistent trend that 1/3 of US Americans utilize these therapies. On the right side, you'll see that these 5 groups of therapies, or rather, I'm sorry, lastly, their Tai Chi, Qigong, and Yoga were kind of lumped into one. These 5 groups had an upward tick in usage over that time. There had been additional research also, studies looking at the utilization more currently, but they kind of drilled down on these 7 categories. And we still see kind of this trend upward, especially with acupuncture as it pertains to this presentation, of its utilization. So even till more recently, there's still interest in utilization of these therapies. Yoga has the most and meditation does. Not surprisingly, the barrier to access those things are much less. Now, more specific to pain management, you can see acupuncture and chiropractic are among the therapies in complementary medicine that have the most utilization. Now, as it pertains to us, when we talk about palliative, a lot of it is going to be related to pain, and of course, a lot in the oncology setting. So when we look at the utilization of CAM among oncology patients worldwide, we see kind of this 18 countries that are Western countries, not East Asia, because of course they utilize a lot of complementary therapy. It will kind of distort the data. But among Western countries, average use is about 40%. Highest is United States. And there's been an increased use of these therapies over 30 years and projected to continue to rise, actually. So one little side note, among the cancer patients, breast cancer patients have the highest utilization of complementary therapies. So no small amount of money is being spent on these therapies. When we look at out-of-pocket spending of physician visits versus complementary alternative medicine practitioner visits, we have $50 billion versus $15 billion. We look at prescription drugs versus natural products, 54 billion versus 13 billion. There's a term that we hear about, big pharma, but there's also a big supplement industry too, to be honest, if I'm being really unbiased about it. So there's a lot that's being promoted in that regard too. And what's interesting also is that regardless of income level, the amount of money being spent also is pretty comparable, so even up to six-figure income, the amount of money being spent yearly is about the same, pretty close. A little background and history about acupuncture. Acupuncture, acus come from the term for needle. Punctura refers to prick or puncture. In its simplest form, acupuncture is the insertion and manipulation of a solid monofilament needle, or filiform needle as we call it, into the body for a therapeutic purpose. There's a lot of confusion about various kinds of needling methods and that whether they're distinct or they're the same. Acupuncture encompasses a wide variety of needling methods. So you might hear of terms that refer to the geography of it. This is Chinese style, this is Japanese or Korean style. You may hear about motor point or dry needling or intramuscular therapy, or things that focus on the ear, for instance. These are all forms of acupuncture, despite what you may hear. So if it uses a solid monofilament needle for a therapeutic purpose, it's acupuncture. It's very, very simple. Acupuncture is one significant arm of the branch of Chinese medicine. Chinese medicine is the whole system. Acupuncture is one major arm of that. So that includes herbal medicine, acupuncture, as I mentioned, nutrition, exercise. That includes things also like Tai Chi and Qigong, and manual therapy. That includes body work, cupping, gua sha or dermal friction. These are all part of the umbrella of Chinese medicine. Now, to add more confusion, there are different terms to refer to Chinese medicine. So you have Chinese medicine, traditional Chinese medicine, classical, Oriental, East Asian. Dispense with the nonsense. It all essentially refers to the same thing. There's actually a migration away from these geographic terms and kind of these nationalistic terms, maybe just talking about acupuncture medicine or acupuncture herbal medicine. So if you hear these kind of terms, they all essentially refer to the same thing in essence. Now, we don't really know how acupuncture got started, so we have some theories, but this kind of cartoon may not be too far off, so some theories include that there was a soldier supposedly that was in the battlefield. He had a shoulder pain. He took a spear in the leg and his pain went away. There's the idea that, of course, it's not unique to East Asia, but that illness was caused by spirits or ghosts, and that they would chase out these ghosts with sharp objects, so. And then there's something more, rational too, where people have observed that, hey, if you bang your knee against a table, you naturally are inclined to kind of rub your knee. What's the extension of that? Maybe add a little bit more force. What's the extension of that? Maybe use an object, a blunt object. What's the extension of that? Let's stick something in there. So it might have been a natural progression that way too. Could be a combination of things. We don't really know totally. The earliest acupuncture needles that we can find that resembles what we use today goes back about 2,000 years. This predates a lot of some of the acupuncture theory too. So this goes back into a prince's tomb about 2,000 years ago. But what's also interesting is that acupuncture historically was not as we just see today. Is almost surgical, actually. So this is actually what we call the 9 needles of acupuncture, and you can kind of see that there's almost like surgical instruments in there. One of the fathers of anesthesia, his name is Huatou. He often doesn't get the credit, but he actually utilized a lot of these instruments for surgery. So he actually concocted anesthesia using a cannabis-based herbal formulation and performed these kind of surgeries. So acupuncture historically was pretty comprehensive. So how did it come into its current incarnation? So when we look at acupuncture, historically, it was taught in kind of a teacher-apprentice kind of structure. So it was passed down in the lineage, in the family, perhaps, kind of like you see in those old kung fu movies, So, but it wasn't until the 1950s that Mao Zedong systematized it and organized it. He formed a committee. The committee developed a curriculum, and the first 5 schools of TCM were established. So, but this was also for a couple of reasons. So one was pragmatic. There was a shortage of medical providers, so they needed more providers. And number 2, there was kind of a political element too. So there was what he perceived was an infringement of Western values on the East. And this is kind of his attempt to be like, screw you in the West, and we're going to preserve kind of our heritage. So part of it was political, part of it was pragmatic, So he established Chinese medicine as a national treasure at that time. Now, as it comes to the United States, how did it arrive here and kind of gain prominence? It was always practiced in small Chinese communities or East Asian communities. But in terms of the forefront of consciousness for us, it was because of this gentleman here. He was traveling to China on a trip with Henry Kissinger ahead of Nixon. And while there, he got appendicitis. So he had surgery in China and was hospitalized and inpatient. So instead of receiving medication inpatient, they sent an acupuncturist up to his room. So he received acupuncture, had significant pain relief, came back to the United States and wrote about it in the New York Times. So it was published in 1971. So that was one of the kind of catalysts for its exposure in the United States to the American forefront of consciousness. Also around the same time, the Young Lords and Black Panthers, a couple of political groups in New York, they had established a detox center at the Lincoln Detox Center. They called the People Drug Program to address the heroin and drug epidemic at the time. One of the founders of this program, his name is Matulu Shakur. He had a good experience with his sons who had acupuncture after a car accident. So he said, hey, how about acupuncture for rehab? And so then auricular therapy was born for what we now call the National Acupuncture National Acupuncture Detox Association protocol that's still in use and exported to over 2,000 centers in the world. So those two events kind of really propelled acupuncture into the American consciousness. In case you guys are curious, that last name Shakur, it's no coincidence. That's actually Tupac Shakur's godfather. So if you guys were history fans of 1990s rap, I might be dating myself. I'm 46. So eventually, the first school of Chinese or acupuncture and Chinese medicine was established in New England, in Boston. Dr. Tin Yao So established it. That was in 1975. This has since merged with the Massachusetts School of Pharmacy in 2016. So, okay, conditions and research. Very quickly. Way back in the early 2000s, the World Health Organization decided to look at the literature with respect to acupuncture and kind of sort it into various categories. So in terms of efficacy. So they looked at RCTs, it just broke them down to 4 categories. They have proven therapeutic effect shown, no further proof needed, limited trials available, and then maybe tried with some, monitoring. And for the first 2 categories, several conditions you can see they kind of cover a wide gamut of symptoms are indicated here. A lot of them, of course, are related to pain. You have some stuff related to oncology side effects, treatment side effects, nausea and vomiting, so on and so forth. So that was done way back in 2003. We'll kind of circle back around to this. Research was continued to develop with respect to acupuncture. So in an ongoing search by 2015, they had found over 870 recommendations for acupuncture for over 100 conditions in over 30 countries. So it kind of falls in line with what they were following, what they were seeing before by WHO. These recommendations came from all over the world, including German associations, from Rwanda Ministry of Health, and even our own very backyard with our Department of Veterans Affairs and Department of Defense. So very commonly used in those areas in the military and the VA, actually. So now, when we talk about acupuncture, it's most synonymously known with pain. And of course, that's one of the things that we like to address in the palliative setting. There are some landmark studies that have been done with respect to acupuncture. These meta-analyses have shown some significant benefit for it. So we're going to go through a few of those. So this for chronic pain looked at nearly 18,000 patients from 29 trials. So this is for back pain, neck pain, shoulder pain, OA, and headaches. They found acupuncture superior to both sham acupuncture and non-acupuncture controls. Sham refers to fake acupuncture. This can be applied in multiple ways. That can be with using, quote, non-acupuncture points. It can be using toothpicks just to create a little pinch. You can be using something called a Streitberger needle, which creates a kind of a false insertion with a specially designed needle. So it found acupuncture, true acupuncture, to be superior for those conditions. Now, there was a follow-up study done by McPherson looking at the effects of its persistence over time. So over 6,000 patients, 20 trials, we found that 90% of the benefit maintained after about 1 year with the possible exception of neck pain. And again, another study done, another meta-analysis done to confirm these findings. This is done by Vickers and Company in 2017 for chronic pain, now over 20,000 patients, 39 trials, superior to both sham and no acupuncture control for each pain condition, confirming what the initial meta-analysis found. Clear evidence that the effects persist over time with some little bit decrease, and strengthens prior key findings about acupuncture for pain relief. So high impact journals showing benefit for acupuncture for management of pain. Now, sometimes you often associate acupuncture with musculoskeletal pain, but it's not just good for musculoskeletal pain. It's actually good for other types of pain, including cancer-related pain, which we often will see in the palliative setting. So this study looked at 920 patients from 14 RCTs. So this includes acupressure as well, I should clarify. Acupressure utilizes acupuncture points, but with digital stimulation. So no insertion or break of the skin. So just to kind of make that clarification. So again, significantly associated with reduced cancer pain and decreased use of analgesics, very safe, no dropouts associated with adverse effects. So that's a nice thing about acupuncture, is that they're very high safety profile when done by a properly trained acupuncturist. Now, we talked about pain, but more specific probably to the palliative setting is management of several symptoms. So symptom clusters, as we call them. Now, there aren't too many studies looking specifically at acupuncture in the palliative setting, so in like say palliation or in a hospice, for instance, but we do have some. So, and it's been kind of increasing the data with respect to that. So we start with this kind of early pilot study. This is back in 2011. Very interesting study looking at acupuncture compared to nurse-led care, palliative nurse-led care. Small study, initially had 20 patients, but 18 ended up completing it. 10 in the acupuncture group, 8 in the palliative-led nurse care group. So patients received acupuncture once a week, 20, 30 minutes for 4 weeks. They had similar time frame for the 20, 30 minutes for the palliative nurse care. So what they found was that with the Edmonton score that they use as the assessment tool before and after each treatment, and then weekly for 6 weeks after completion of that course of 4 weeks treatment. So looking at a little bit of long-term benefits too. So they looked at pain, tiredness, nausea, depression, anxiety, drowsiness, loss of appetite, lack of well-being, and shortness of breath. So not only symptoms, but in essence, quality of life, right? So lower after each acupuncture treatment were the ESAS scores. Largest reductions seen for pain and tiredness. After 6 weeks of acupuncture, all the symptoms remain improved except for pain, nausea, and loss of appetite. 6 of the symptom categories were improved for nurse-led care. All 9 were improved after 6 weeks, from the post course. So not tiredness, nausea, or depression. So we see some lingering effects with acupuncture. Now, granted, it's not a super long course. There would be some maintenance done after that, but there is some interest in looking into this further, which continue to happen. So we have this kind of reiterates what I mentioned earlier in terms of the percentages. But we look a little bit more forward, benefit from incorporating acupuncture to help with symptoms of advanced incurable cancer, well tolerated, no significant or unexpected side effects. So this prompted more interest in the acupuncture in the palliative care setting. So we look at this for acupuncture-related therapies for symptom management and palliative care, cancer care. Again, clusters of symptoms, very similar: pain, quality of life, anorexia, constipation, fatigue, insomnia, paresthesia, and dysthesia. Basically, that's kind of neuropathy. We have a little bit larger sample size here, which is nice. And what we find is that acupuncture and related therapy significantly reduce pain in cancer patients. Again, the pain relieving theme. Quicker analgesic effect and longer analgesic duration when compared with conventional medicine. Acupressure or acupressure plus essential oil showed efficacy in improving fatigue in lung cancer patients, a little bit more specific subcategory of patients. Combined with Chinese herbal medicine and conventional medications, improve quality of life among cancer patients, and also effective in anorexia, or not. It's a bit unclear with respect to anorexia, constipation, paresthesia, and dysthesia, insomnia, and edema. So this was kind of still early on in terms of the palliative care setting. And as we kind of move forward with palliation, we'll see more clear data as far as acupuncture is concerned. But again, to reiterate, safe, should be considered as an adjuvant option for the management of pain, fatigue, and improving quality of life in cancer patients. So in essence, what they're saying is you have nothing to lose by trying acupuncture in a palliative care setting. So again, a brief narrative of review of evidence and recommendations for acupuncture within the palliative care setting. Emerging evidence, as you can kind of see it building up over time here. Most were oncology, naturally speaking. Evidence for use of acupuncture to treat symptoms in palliative care, relatively weak because the evidence base was not as strong quite yet. Worldwide, increasingly recommending acupuncture as a treatment for symptoms in palliative care. Again, safe, non-pharmacological, significant effects clinically, and very pragmatic to kind of help bridge that gap, between symptom management and the kind of medication. So now we go a little bit further into more recent studies. So we find some more data here. So looking at nearly 5,000 patients, 59 studies. In combination, reductions in pain, more than just analgesics alone, immediate and long-term effects on pain, and effective for all included pain types. So like I mentioned earlier, not just good for musculoskeletal pain, there's different kinds of neuropathic pain, inflammatory pain, cancer-related pain. So it's quite wide breadth. So whereas medication may target one specific one, like for instance, gabapentin for neuropathic pain, acupuncture is a bit more versatile. And we'll go into that a little bit more detail later in terms of the mechanisms explain why that's the case. Again, quality of life, which naturally would follow if you're reducing some of these kind of the symptom burden of these kind of these presentations these patients are having. Again, just to reiterate, better global improvement rate with using combination. Again, supporting acupuncture for derived therapies during palliative care management. Now, so hopefully that will continue to kind of prompt further research in this kind of setting. But you can see as we have a larger base of patients here, we're getting more and more clarity as far as where acupuncture can intervene, especially for pain, but also in other elements of well-being. Now, sore spots. So I refer to these sore spots, especially in conversing with various oncologists and other physicians here in Henry Ford. These are areas where conventional medicine has a hard time dealing with it. And this is kind of where, we in complementary medicine, acupuncture, physical therapy, actually work a lot of physical therapists, exercise physiologists. They can help try to intervene in a very conservative way and try to reduce the reliance on medications, for instance. So one of the biggest sore spots that they complain of is neuropathy, right? So they don't really have any great options. Medications like gabapentin, Lyrica, Cymbalta, they can be helpful for managing the painful aspect of neuropathy, but doesn't really help in terms of getting feeling back and improving function, necessarily. So this is kind of where we can intervene. So chemotherapy-induced neuropathy or drug-induced neuropathy, peripheral nerve damage is a consequence of cancer drugs. Common side effect can limit treatment. What I mean by that is that if the neuropathy progresses enough, treatment will be halted or dosage be reduced. So that gives a potential opportunity for cancer to proliferate, and maybe not optimize the intention of the oncologist. And it significantly reduces quality of life. So one of the big things that maybe is underestimated is the quality of life. I have many patients complain that not only is it just the sensory aspect, the numbness, the tingling, the other paresthesias, but there's also psychological aspects. There's also social aspects, right? So for instance, I have many patients complain that they are afraid to engage and go to, gatherings. They want to say, oh, they're afraid that they may look drunk because they don't have stable gait, or that they may be dropping or breaking things and cause some embarrassment, right? So there are these elements too that maybe we don't initially think about at first when it comes to neuropathy, maybe a little bit too preoccupied with the feeling part of it. So there are many things that it touches in terms of the patient's quality of life. So neuropathy, oftentimes it gets associated with just numbness and tingling, but actually it encompasses a wide variety of paresthesias. Numbness and tingling are probably the most common, but you can get sharp sensations, dull sensations, cold, hot, throbbing sensations, hypersensitivity, also not uncommon as well. So it encompasses all those things. Patients describe being like they're walking on cushions, or they're saying, I feel like I'm walking on pebbles or gravel. So it's important to clarify to these patients that this is kind of part of the spectrum of neuropathy, and that is not unusual. I've had some patients express that I feel like, am I going to lose my foot? Am I going to lose my hand because these sensations are getting worse, right? Or I'm getting these new paresthesias, So the education, the part is very, very important. But most common, sensory. And motor, not as common. Sometimes central neuropathy occurs as well. That affects especially the GI system, as you would imagine. But as it pertains to what we're talking about here, the stubborn area that a lot of patients or a lot of doctors complain about is neuropathy. Several agents in the oncology setting used causes neuropathy. These are kind of the categories you may see. I also see some agents may exacerbate it, like immunotherapies, for instance, right? So it doesn't necessarily cause it, but I have patients that have gone through a course of chemotherapy and go on to maintenance immunotherapy, and they find that after infusions, their neuropathy flares up, So there's maybe that element too. So we look at the efficacy of acupuncture against CIPN. Over 1,000 patients, okay? Overall effectiveness superior to that of neurotropic drugs. Recovery of sensory function better than motor function. That bears to be true in my experience as well. So motor function can be a little bit difficult to address. I've had some success with it, but much more so with sensory. Again, we go back to that early cluster symptom management. Even though the focus of the study was on CIPN, they also found secondary outcome measures such as nausea, appetite, fatigue and drowsiness also improved as well. The caveat is when it comes to neuropathy. And I should say that with any kind of neuropathy or any kind of nerve damage, whether it's chemotherapy induced, if it's diabetic, if it's some kind of injury or post-operative, the course of recovery is very, very slow. It takes a long time. So patients will not see necessarily improvements right away. They may have fleeting or transient improvements early on into the course of treatment. So when I talk to patients, it's very important that I tell them, you have to be kind of patient with it. Actually, not too dissimilar from rehab as well. You kind of probably have to tell them, this is more like a marathon, not so much like a sprint, right? Same thing as it pertains to neuropathy, So, and I should say over the course of time, it may be hard to tease out the recovery sensations versus the actual neuropathy sensations because they can kind of mimic each other a little bit. So as the nerves recover, they may have different kind of tinglings or sharp shooting sensations like lightning bolts, for instance, or itching or aching. That can be signs of nerve growth. So that's important too to kind of convey to the patient so they don't get confused and think that this is worsening neuropathy, but actually I tell them kind of growing pains, so. Probably among my top two. So I mentioned neuropathy, vasomotor symptoms. So this is very much a stubborn area for conventional medicine as well. So this refers to primarily hot flashes and night sweats. So this can be induced by chemotherapy. So it can put women early into menopause. And hormone therapy can also cause it as well, also induce early menopause, or kind of almost bring about it again, that people have already gone into menopause can kind of reproduce these symptoms. Treatment-induced vasomotor symptoms typically are more aggressive than naturally induced, and it also impairs quality of life significantly. So of course, you would see this a lot in the breast cancer population, but you also see it in the prostate cancer population. I can tell you without fail, almost without fail, my prostate cancer patients that undergo hormone therapy, they experience hot flashes and night sweats. And they say, I did not understand or appreciate what my wife was going through, but now I get it, so it really does have a big impact. So several agents can cause this, but most commonly, you're going to see this probably with respect to breast cancer patients and them being on hormone therapy or endocrine therapy, as we refer to it as well. So again, sharp decline in estrogen seems to be one of the indicators, although it's not fully understood. And there's some kind of dysfunction in the thermoregulatory nucleus, almost like the thermostat of the body seems to be disrupted, as a result of the treatment. So we look at some of the side effects. So hormone-related side effects. So over 2,000 patients. Improvements in hot flashes, fatigue, and stiffness. Still lacks large sample multi-center trials, but we do see some improvements in respect to that. Actually, one of our oncologists, radiation oncologists here at Henry Ford, Dr. Eleanor Walker, did a study back in 2010 or 11 that was published in JCO, High Impact Journal, looking at acupuncture versus venlafaxine, or Effexor, as it's called. And what they found was that acupuncture was just as effective, had longer duration of relief, had no side effects, and it had also ancillary benefits for things such as stress reduction, improved libido, and improved energy as well. But this kind of gives you an idea of some of the benefits with respect to acupuncture for vasomotor symptoms. Another area also related to hormone therapy, aromatase inhibitor-induced arthralgias, also a very stubborn area that oncologists have a hard time kind of managing. So unfortunately, with this kind of group of medications, things like aromasin, arimidex, letrozole, these can cause pronounced side effects. In addition to hot flashes, a lot of joint pains and stiffness, among other things too, sometimes some brain fog as well, some fatigue. But this is a very stubborn area. Between these two symptoms related to endocrine therapy, oftentimes, well, I shouldn't say oftentimes, but many times patients cannot maintain on it and have to discontinue it. So for hormone receptor positive breast cancers, this suppresses the estrogen, and it's important to reduce the chance of recurrence. And oftentimes these patients are on these medications for 5 or even in some cases 10 years. So it's quite a haul. So if we can do anything to help kind of manage these and make that kind of course much more manageable, that would be definitely a win. So we look at acupuncture for AIAs. Again, over 200 patients for this multi-center trial. So 2 sessions per week for 6 weeks, 1 session for additional 6 weeks after, which is kind of, I really like the way they designed the study because it kind of has the taper, right? So the idea with acupuncture is that you don't want to see the patient every week forever. You want to kind of front load a little bit and then kind of taper off into some kind of maintenance phase. They try to reproduce that in the study. So you have assessments done at various time points, pain assessment with the brief pain index or inventory rather, I'm sorry. So statistics, and I'm sorry, there's 3 groups, true acupuncture, sham acupuncture, and weightless control. So we find that true acupuncture had sustained benefits that were better than sham acupuncture and weightless control after 1 year. The biggest difference between true acupuncture and sham acupuncture were at 52 weeks at the very end. And the biggest difference between true acupuncture and weightless was at 12 weeks. But overall, still true acupuncture versus both of those kind of groups, improvements, relatively speaking. There also were secondary measures of pain medication usage over that time period. So they started with the baseline, or they looked at the baseline patients that had no medication, no pain usage, pain medication usage. So in that kind of group, there were 91 patients. So 44 in true acupuncture, 23 in sham, and 24 in weightless control. And new medication usage was the least in the true acupuncture group. So it helps reduce the reliance on pain medication as well. So another area, I don't see too many head and neck cancer patients, relatively speaking, in terms of the numbers. Incidence is lower in that population, but there is a very stubborn area of xerostomia, dry mouth with respect to head and neck cancer patients, especially if they undergo surgery and radiation. So a very difficult population, a tough course. And you guys will, we refer to you guys a lot, especially for some of the lymphedema that may occur around the neck. Help with some of the manual drainage. They endure quite a bit, this population. So also severely impacts quality of life, as you can imagine, with the loss of salivation and also taste often sometimes too. So we look at acupuncture for xerostomia, 258 patients, standard oral hygiene, true acupuncture, sham acupuncture, 3 groups, 3-arm study. So true acupuncture more effective for radiation-induced xerostomia 1 or more years after the end of radiotherapy than sham or oral hygiene. Again, minimally invasive, low incidence of adverse effects, which is pretty interesting because there's sometimes concern with some of the irradiated area, there's skin and tissue changes in those areas. So still safe to apply. Superior standard care, again, reiterating that, may be considered as a treatment option for patients with chronic radiation-induced xerostomia. So beneficial potentially. There definitely needs to be more studies with respect to this population. Another secondary benefit with respect to acupuncture in this population is some of the neck pain. Say if they have a neck dissection, they get fibrotic muscles in the area, limited range of motion. That can be helpful as well. We work a lot with the physical therapists here at Henry Ford, so I may treat the area, kind of help loosen things up to help maximize the range of motion for the physical therapist to take advantage of. I kind of added this. It's a very interesting study. It's a mechanistic study looking at a specific point in the finger for xerostomia. And this is a functional MRI study looking at what parts of the brain are activated when we needle this point in the finger. So what's interesting is that actually you can see the point there on the finger. There's kind of near the MCP. And we find that point is called LI2. When we stimulate it, it's associated with activation of certain parts of the brain that are correlated with salivary production. So that might give some insight into how acupuncture works for salivary production. So these kind of traditional observations that these ancient physicians had observed seem to kind of bear true in certain situations. So pretty interesting. So I just thought I'd throw that in as a kind of little tidbit. So we're looking at some of the physical aspects of care here with acupuncture, but there's also some subjective experiences that people express. And there's some interesting studies that look at that. So we look at this one that's done in the European Journal of Cancer Care. This is used in a hospice setting. It's not too common, I would say, acupuncture, but some institutions do incorporate it to help kind of patients, of course, manage the symptom burden and also help them, in essence, transition as well. So this is a very small pilot study looking at 18 patients from 3 hospice settings. 2 overarching themes emerged: patient perceptions of the effects of acupuncture and factors that enabled acupuncture to have these effects. So we look at some of the quotes that were pulled from that study. So in this case here, didn't kill the pain completely, but it just chopped it. So that's very, very common. And that's actually a very interesting segue, I should say, into managing expectations, especially in these kind of patient populations, chronic pain, cancer patients. It's not always realistic to help eliminate the symptoms altogether, right? We have to kind of convey that we want to make it more manageable. If we get to that point where we can kind of eliminate it, even at temporary, that's great, but sometimes it's not realistic. So I always tell patients, the idea here is to try and make your quality of life better, to make the symptom more manageable, to minimize reliance on medications and keep you on course of your treatment if you are actively going through treatment, right? So that's kind of the idea. Quality of life, second quote, I can go to the toilet myself, so he didn't want to rely on his mom anymore. So in this case, that was a big deal for him, so this person mentions he felt calm, felt free. There's some kind of emotional component to it too. This person was almost in disbelief. This isn't real. Unbelievable how good it makes me feel. A lot of the chemicals released with acupuncture, including natural endorphins, have that kind of effect, that kind of almost, some people describe a bit of a high, for lack of a better term, people have expressed to me with acupuncture. This person refers to some kind of spiritual aspect that was kind of tapped into as well with acupuncture, like it was bringing it out of him. So again, highly acceptable, accessible, very safe profile, no serious adverse effects on physical, mental, and spiritual health. So now this is a very recent study just published earlier this year, a very interesting patient narratives in an integrative oncology study in Israel during the war, the Israel-Gaza war. So looking at manual relaxation, that includes things such as, I think they said acupressure, breathing exercises, meditation, plus compared to manual relaxation plus acupuncture. So relatively smaller study, but still 58 patients in manual relaxation, 67 in the combination, assessed immediately after, and then 24 hours after that. So right after treatment, and then 1 day post-treatment. So this person goes on to say, acupuncture treatment is a time when there is no pain anywhere in the body, no place burns or pulsates. So breast cancer recurrence potentially patient. Less pain, can start the day anew. I slept last night like I haven't slept for a while. Now I can start the day. Right after treatment, I felt really good, which lasted until the evening. There was fatigue, but no terrible headaches. Now the symptoms of the chemo are returning slowly. I didn't need to do my breathing exercises, so even though it's been a long day. So again, so maybe not necessarily completely eliminate symptoms, but can relieve some of the burden, make quality of life a little bit better. And granted, this is a very short course. Of course, you would probably ideally want to have ongoing some kind of maintenance, but it just shows you that even in a very short period of time, you can get some symptom relief. So emotionally related concerns and a sense of calmness were more significant in the narratives of patients treated with manual relaxation alone, pain relief in combination with more so with acupuncture, right? So pretty interesting study, given the circumstances especially. So you remember back in the early part of this presentation, I mentioned that study done by the WHO, that committee that was formed to look at the data at the time with respect to acupuncture and RCTs. So a similar thing was done back in 2017 by the Australian Acupuncture and Chinese Medicine Association. It kind of broke it down also into 4 levels of evidence: positive effect, potential positive effect, unclear, insufficient evidence, and no evidence of effect. So what they found was that over 30 conditions with evidence of positive, potential positive effect were found. Many of those were found in the palliative care setting. So everything from anxiety, again, excuse me, induced arthralgias, nausea and vomiting, depression, so physical, and mental conditions. I should mention with the nausea and vomiting, it is very amenable to acupuncture, both chemotherapy induced, whether it's pregnancy as well, seasickness, those kind of things. But to be honest, I have not seen as much of that, in recent years. The GI cocktails that are used nowadays do a very good job of managing that. So I do see it occasionally for refractory situations. But if you have patients that are dealing with that and want to manage it conservatively, acupuncture is an option, even though I have not mentioned it in this presentation. But like I mentioned, in the oncology setting, or otherwise, the GI cocktails do a very, very good job. Also, sometimes with GI distress like constipation, diarrhea, whether it's senna or Imodium, respectively, so they can do a pretty good job of managing that, but also typically pretty amenable to acupuncture as well. So quite a wide spectrum of conditions that are amenable to acupuncture in the palliative care setting. Okay, now we have this, we look at some of the data that I kind of plucked. There's quite a bit out there, but I tried to kind of pluck some representative studies here. And there's kind of a wide swath of conditions that are being addressed by acupuncture. It's not to say that it's some kind of panacea or cure-all. It is not. And to be honest, some of the claims can be exaggerated, especially by people in my field or people that are kind of in that kind of realm. So we'll go over a little bit of how acupuncture works, and I'll clarify some of those misunderstandings as well. But I'll also explain why acupuncture has this kind of wide spectrum of effect. Now, you may have heard these different kind of terms with respect to acupuncture. You may hear about points or acupoints and meridians and channels and qi, right? So now, qi, it's a common term that you hear thrown around with respect to kind of new agey, kind of alternative medicine kind of thing. So what does qi equal? People say it refers to energy, right? So, and it's become kind of almost like a household term. I mean, it's kind of even permeated into kind of pop culture, for instance, right? There was a beverage called qi, like a Sobe beverage. Back in the day, I don't even know if it exists anymore. You have qi certified chargers, like for your Samsung phone, qi in movies and video games and TV shows. So the only problem is that qi is not equal energy. Despite how common this kind of translation is, it is not equal energy. And it's unfortunately perpetuated too by my colleagues in my field as well. So Paul Unscheld, the world's foremost expert on Chinese medicine, he's actually an academic, he's not a practitioner. So he has translated several ancient Chinese medical texts. And he goes on to say, qi is one of the very few Chinese terms we have chosen to transliterate rather than translate. It should be noted that the translation of qi as energy, so widespread today, lacks any historical basis. So why did this happen? Where did this come from, this kind of term of qi as energy? It came from this gentleman here, George Sully du Morant. He was a French diplomat that was residing in Shanghai. So while he was in Shanghai, he was witness to the cholera epidemic, and he saw the benefits supposedly of acupuncture and Chinese medicine on the cholera epidemic at the time. So it inspired him to study Chinese medicine and acupuncture. So he would go on to write a text and translate multiple Chinese medical texts into French at the time. And some of these are actually questioned as well. People are saying, well, maybe he might have been a charlatan. But regardless, his works were actually the basis for a Nobel Prize nomination, believe it or not. So anyway, the problem is that when he came across the term qi, he goes on to say, for lack of a better term, he translated it as energy. He was also looking at things like Indian medicine, Ayurveda, so on and so forth, and then kind of used that term. But he went on to say, for lack of a better term, somehow that part was missed. The problem is that when you try to translate Chinese characters into English, you run into problems because Chinese is a highly contextual language. You're not just translating sounds, or just objects or things, right? So, for instance, this character is jiang, so it refers to talking, speaking, to explain, to tell something. On the right here is a term called tai. This refers to a platform, some kind of support system, a desk. If you put these terms together, it becomes a lecture platform or a podium, right? So it depends on the character surrounding, what the meaning takes on. I take these two characters and put in the context of other characters. I can deduce further, is it referring to a podium, a lectern, a pulpit, right? So I need to see what's going on around it. So it can be a little dynamic, right? And that's kind of difficulty why it can be so hard to learn Chinese, for instance, or vice versa, try to translate, especially ancient Chinese texts into English, let alone from French into English, right? So you can see it can become quite complicated. So the kind of the thrust of it is that there's not really a clear translation for qi. It's not energy though, right? So it is relative depending on the circumstance, depending on how it's being discussed, right? So it's almost something that has to be understood, not necessarily has to be translated in a one-to-one way. As much as we want to do that, we can't quite do that with the term qi. There are over 70 different combinations that character for qi is used in, right? So it gets kind of complicated. Now, early theories about acupuncture. This goes back to the 60s and 70s. There was the endorphin release that still stands. There is the pain gate theory that still stands as well. There's also placebo, which is totally reasonable given the time, right? Here you have this needle, there's no medication on needle. How could it possibly work, right? We now know that it's not just placebo. We know this because when we cut off the afferent nerves, it loses the effect. When we cut off the efferent nerves, the effect is not lost, it's maintained. So we know that it's not just placebo. There are several biochemical, neurological mechanisms that have been identified over the years, induces the release of various neurotransmitters and modulation of different chemicals that influence pain and other processes. So also, anatomically speaking, when we look at the acupuncture points, there's over 90% correspondence to established channel-based acupuncture points to trigger points. So there's a correspondence to that, very high correspondence. Standard acupuncture points there's over 360 standard ones. There are numerous extra ones, but it's also not limited to those defined ones. There are also what we call ashi points or ashur points that are, for instance, tender points that are off channels or off standard points that are used. So in essence, acupuncture can be applied almost anywhere, but there are standard points that have unique features to them. Acupuncture channels or networks that I mentioned earlier, they follow different myofascial tissue planes and nerve and vascular pathways as well. So very high correspondence, over 80% to those pathways as well. Now, when we look at the acupuncture point anatomy itself, the standard ones, what we find is that those acupuncture points have a higher concentration of nerves and vessels at them. We call them neurovascular bundles. As you kind of needle those points, the more kind of you bullseye, the more you kind of get a certain sensation. These sensations we call the chi. This may include things like a dull, achy sensation, a twitching sensation, or a twitching along a muscle, for instance, some tingling sensation, some referral, say, for instance, down an arm or a leg. Some people describe it as kind of like a little lightning bolt or kind of water trickling. So as you kind of bullseye that point, you get a little bit more of that sensation. So neurovascular bundles are the anatomy of the acupuncture point, as well as there's some interesting anatomy with the channels. So the channels themselves, those kind of, as you see on the left side, that's what we call the UB channel. That's one example. And in the middle is the UB channel drawn on a strict line of pull, just for simplification. On the right side, that's the myofascial, that's the connective tissue plane that has been resected from a fresh cadaver, right? And it follows right along that UB channel. So this goes to kind of explaining that this kind of mysticism often associated with acupuncture, or this kind of chi as this kind of energy, is more of a misunderstanding. So they're actually referring to various anatomical parts of the body, right? The points have neurovascular bundles. The channels follow a lot of nerve and vessel planes, connective tissue planes. It's very, if you look at it objectively, it's kind of silly to think that these Chinese physicians were looking at dissected bodies and arriving at something invisible, right? So they are looking at all these kind of factors. And what we now know too, connective tissue, as you guys I'm sure are very well aware of, for a long time was overlooked. It was kind of looked at as something inert. It was something that was kind of cut through to get to the good stuff. We now know it's not inert. It's a very important structure. It has functions in terms of nerve conduction, nutrition, fluid flow, right? So nourishment. So it's not this inert structure. And when we look at acupuncture in terms of a mechanism, when you put the needle in and you stimulate it, you rotate it, for instance, you're winding that connective tissue. That's some engagements happening there that creates a cascade of response that happens and relays signals to the brain and spinal cord. Also, those acupuncture point sites, I mentioned they are more concentrated in nerves and vessels. They're also more concentrated in ATP, so that's kind of energy, if you want to call it that, in that sense. But of course, they didn't know that back then. But referring to it in the modern context as ATP. So when stimulating acupuncture point, ATP is released. And what happens is that that release of energy sends signals to the brain and spinal cord. So it relays signals that help regulate various functions of the body. So it relates to the gut, the lung, the heart, reproduction, pain modulation, so on and so forth. That's why, as I mentioned earlier, we have this wide spectrum of effect. How is it happening? Because of the way it communicates through the nervous system to the brain and spinal cord. In essence, acupuncture helps regulate things through the nervous system primarily. That's what it does. So if you start to put things back in balance or relative balance, you can see kind of a downstream effect where it can help address various kind of symptoms, right? You cannot yank on one thing in one system and not have it affect everything else, right? and reciprocal. You put it back in, it might kind of help restore some balance into the global system, right? So Chinese medicine, a lot of traditional medicines never looked at things separately. It was all integrated, right? So, and this kind of helps kind of convey that idea of why that kind of works and why they kind of recognize that this kind of very important interplay between these various systems. Um, Logistics. So very practical things to kind of go through very quickly. What credentials matter? So I have many patients, they kind of come in, they're like, so what was your training when you did this? So I might be dating myself. So back in the 90s, there were these nighttime commercials where you had this kind of before online training. You had this lady, I think she was, I don't know if she was a soap opera star or not, but her name was Sally Struthers. She would promote these kind of distance training courses. You get these VHS cassettes to learn how to get certification and these various things, repair and computer programming and so on and so forth. So some people thought, you do like a weekend course or something? I'm like, no, it's a bit more exhaustive than that. I hope so if you're sticking needles in somebody. So if you want to refer to an acupuncturist, you have to make sure that they're properly credentialed. So at minimum, acupuncturists have a master's degree. So that's accredited by the ACAHM. That's the Accreditation Commission for Acupuncture and Herbal Medicine. That's recognized by the Department of Education. So at minimum, you have to have that to sit for board examinations. Some have transitional or first professional doctorates, like the DAC, for instance, or DTCM. And then there are some of us that have the DAOM, which specializes in a certain field. For instance, mine was in oncology. Others may be in women's health, for instance. So you want to make sure at the minimum they have a master's degree and have board examinations passed. So the examinations are administered by the NCCOM, that's a national certification. They give the examinations for everybody but California. California has their own examinations. So in order to be board certified, you have to pass examinations from either one of those associations. And of course, register with the state and then achieve proper licensing through their requirements, right? So these are kind of designations that you may see for the various states. So if also, I should say, as an option too, medical doctors and DOs can also do acupuncture with certain training as well. So the AAMA and these are kind of samples. That's one of the more popular ones in the United States, and there's McMaster's in Canada. Physicians have to go through several hundred hours of acupuncture training, pass examinations. I think for the AAMA, they have to also publish a paper, in order to get certain credentialing for acupuncture. So those are options. You have the acupuncturist, and you also have the medical doctor or DO that may be certified in acupuncture properly. Cautions, contraindications. The ones I would say to kind of keep an eye on as it pertains to palliative medicine, look at the platelets and the ANCs. At this stage, I'm probably not going to be, if they're below 500, they're probably not going to be able to come see me for ANCs, for instance, right? So depending on the institution, the threshold may be a little bit different. Some say 1,000 to cut off. Some say 500. If they're much lower than that, probably in the hospital. So I have never had a patient with an infection in over 15 years of doing this with acupuncture. Again, very, very safe. So platelet counts. A lot of patients ask me, can I do this with blood thinners? Yes, totally fine with blood thinners, no problem. Of note also, electroacupuncture. Patients with a pacemaker or defibrillator, you can't do it. So that's a contraindication for that. I'll draw your attention to number 3.2 and 3.3. Lymphedema. Generally speaking, they will tell you no IVs or blood draws or blood pressure as caution or contraindicated on the lymphodematous limb. Say post lumpectomy or post mastectomy, for instance. Acupuncture is an exception. So there actually have been studies looking at acupuncture for lymphedema. There has been some minimal improvements, but more importantly, it's been shown to be applied safely. And I mentioned that because, say, if you have a patient with neuropathy and I need to needle that side, I can do so safely. So I know oncologists and some of the other providers are very cautious about that, but actually acupuncture is an exception with respect to that. Other cautions: pregnancy. Certain points supposedly have maybe induced contractions. There's mixed data in terms of the traditional literature with respect to that. I think I'd be more concerned about local needling and aggressiveness of needling with respect to pregnancy. Epilepsy, as you can imagine, confuse patients. involuntary movements, things like Huntington's disease, right? So for instance, you have to be cautious with that. And then patients that are very emaciated, higher risk of nerve damage and organ puncture with that, right? So um, adverse
Dr.
effects.
Z, thank
Yes.
you so much for your time. I wanted to just point to the chat, which had a couple of questions that might make sense about now. I'll throw them
Yes.
out there and then you tell me whether that works. One of them has to do specifically with lung cancer.
Yes.
Another to do with more skin, like eczema and that kind of thing being a contraindication. And then also about pacemakers and acupuncture v acupressure. So I thought I'd throw those out. Those are all in the chat right now. And I know we are getting near time. So I
Okay.
wanted to make sure you saw those.
Yeah, I'm sorry, I couldn't see the questions in the chat here. It's on the full screen. But so the questions about the skin condition. Yes, as you can see on the screen here, poor skin condition. So we cannot needle into those areas that may have kind of irritated or broken skin. So that's also contraindicated. You can maybe surround the area, but not go into the area. And then what was it about the pacemaker?
Pacemaker contraindicated for acupuncture versus acupressure.
Acupressure is okay. Yeah. So, but for acupuncture, acupressure is okay, but acupuncture with electrical stimulations, not okay. So,
and then lung cancer in particular, there was somebody asking about.
yes, that there's anything in particular with that population that they're asking about. Generally speaking, they're okay to treat, if they're manifesting any of these symptoms I kind of mentioned earlier. So,
Marceline, I don't know if you have anything specific to add there. She's asking the efficacy of acupuncture in the treatment of patients with lung cancer.
Yeah, it depends on the system. So some symptoms. So some symptoms may be more unique to lung cancer patients, like difficulty of breathing or shortness of breath. There has been some data that show that acupuncture can be helpful for those patients. Fatigue as well. So in addition to any other symptoms they may have, like neuropathy due to kind of chemotherapy, but unique to that population, things like I mentioned, fatigue, difficulty breathing, it can be helpful.
Thank you.
Yeah. Yes. So very quickly, we're kind of winding down here. So some things that may happen with acupuncture. Most commonly, you may have some lightheadedness. You may have some echo sensation, for instance, where people feel like there's still some needles lingering or some dull, achy sensation at the needling sites. That's kind of normal, not uncommon. A lot of these other things may be related to kind of negligence or poor needling by the practitioner, such as a pneumothorax or nerve damage, right? But the most common ones would be some lightheadedness, especially if they're face down, for treatment, and then like I said, phantom sensations or echo after treatment. Bruising happens occasionally. It's very, very small, not like getting a blood draw or an IV. So I do have some patients to get an emotional release. They kind of spontaneously just cry for no reason. Like I just don't know why I'm crying, but it feels very cathartic. So that might be a little unsettling for patients that they don't know what's going on with it. Quickly, two big structures with acupuncture: individual, community. Individuals, as it sounds, one-on-one. That's the most common structure that you see here. Community is used. You have 4 or 5 patients in a room to help mitigate some of the cost of acupuncture. There's limitations. You only have access to the front of the body. You don't have access typically to accessory techniques like electrical acupuncture or sometimes temperature therapy. So there's some limitations, but may be good for certain populations or certain symptoms. Pricing, this is kind of a sample of what we have at Henry Ford, $151 for initial, $100 for follow-up. Pretty comparable to what you see in the private sector. So if you want to have an idea of what it would cost for a patient, that's kind of a good average. You can kind of see. Some may offer packages. Some private practitioners may offer a sliding scale, as well to help kind of with the cost burden. Insurance, unfortunately, most insurances does not cover acupuncture, although it depends on the state. If you're on the West Coast, California, they do cover a lot of conditions for acupuncture, although there is some now Medicare is actually covering for low back pain, I should say. So, but the caveat is that acupuncturists are not recognized providers for Medicare yet, so there has to be some oversight by a physician to sign off on it, but we're working on that. There are other avenues for coverage. PIP claims, workers' comp, FSA or HSA can cover acupuncture. Veterans Choice Program, so our vets can also get acupuncture through the VA, or if they don't have access to their VA or too long a wait, they can go outside and have coverage for acupuncture. And philanthropy, so some hospital systems or clinics may offer some grant-funded acupuncture. very quickly, average 1 to 2 times a week, 8 to 12 treatments, very common kind of structure. You ideally want to taper off, at some point. Very quick resources, different websites. Acupuncture Now Foundation. This promotes kind of knowledge about acupuncture. They also produce a documentary about it. This is the National Association, the ASA. I used to be part of this board here. They have some great free resources on there that you can give for patients and for practitioners, medical doctors and other allied professionals. This has various kind of evidence-based research summaries for different conditions. And then that's a National Certification Commission. That, if you want to find an acupuncturist in your respective state that's properly credentialed, they have a database there you can look into. And that California has their own, as I mentioned as well. Some documentaries. There's one about a bodybuilder that had a stroke, very touching documentary, 9,000 Needles, and kind of looks at his recovery process after conventional care kind of failed him. His brother took him to China, and it chronicles his kind of recovery with acupuncture over a time period. Getting to the Point is the ANF's documentary about acupuncture in Children's Hospital. And then Dopa's Death is Matul Shakur and company about their project in New York for rehab and acupuncture. Okay. Thanks for your patience. There's a lot to cover. I appreciate you guys' patience for all that. It's pretty dense, but any questions about anything?
Thank you, Dr. Z. Any questions? I know we're running a little bit long, so if people have to head out, that's okay. But thank you so much for your really, really informative presentation. I see Becky that's unmuted. Becky, do you want to ask a question or no?
No, I just wanted to say that was incredible. Thank you very much.
Oh, you're very welcome. Thank you for the kind words. Yeah, it was a little ambitious, but I want to get, the kind of a lot of the bases covered for you guys. So
no, we really appreciate it. And we don't necessarily have any scheduled events for 2026 yet, but the American Palliative Rehab Alliance board is working on it. So you'll be hearing more from us probably closer to the holidays with some announcements for 2026. And don't forget, palliativerehab.com is the website, and this recording and all of our other past recording of our webinars will be on there. So thank you so much again, Dr. Z, and thank you all for attending, and have a happy Thanksgiving if you're in the United States, or if we don't see you, have happy holidays. Thanks, everyone.
Thank you guys for having me. Happy holidays.
Dr. Z, is it okay if people, if we share your email with people if they ask?
Oh, absolutely. Yeah.
Right here? Okay. Other people?
Right there.
Great. Thanks.
Yes.
Happy Thanksgiving.
Perfect. Thanks, everyone.
Bye-bye, guys.